So, with regards to this session, we'll talk about what health roles there are and what do we need to understand regarding health and social care practitioners. There's several roles that are we should be knowing, and we should be knowing like if we are dealing with a patient, or if we are dealing with a person who's under our care, we should know what are the different roles of health and social care practitioners and where to signpost those people, basically. So today's session, in today's session, we'll talk about the roles and responsibilities of various people who are employed within the health and social care sectors. We'll talk about different partnerships that are there, such as team working, multidisciplinary working, effective partnership working. What is the importance of communication, identifying and reducing barriers, understanding different boundaries that people have, whoever's involved in the care. So it may be caregivers like you, or it may be people who are under your care. Contracting, roles and responsibilities, relationships between health and social care. I hope my screen is visible to you and it's clear enough. So there's some key terminologies that we'll talk about. So it's what is a healthcare practitioner, or what are healthcare practitioners? So they're professions or professionals who would be working, you'll be expecting them to be working in a healthcare industry. So we call it an industry because it is a business, if you see it as a whole, generally speaking. So it's an industry and which is specialized in medical care, and it specializes in provision of medical care to patients. So these people, these medical healthcare practitioners, they are trained for various tasks. So it's to diagnose, treat, and prevent illnesses and injuries, as well as provide ongoing care and support for their patients. Now, ongoing care, we talked about people who require ongoing care. So it was basically people who were diagnosed with chronic disabilities or chronic conditions. We talked about diabetes, we talked about hypertension yesterday, dementia, for instance. There's some examples of healthcare practitioners. So the physicians, nurses, you know, amongst these people also, dentists, pharmacists, physical therapists, occupational therapists, speech language pathologists, many others. Each of these have their own specialized training. So you would be, if you're a nurse, you have a nursing specialism, specialist training. If you're a dentist, you're specialized in that. And they have a skill set to address specific health concerns and conditions. So healthcare practitioners in general, they play a crucial role in promoting and maintaining the health and well-being of individuals and families and communities. They work in a variety of settings. These include hospitals, clinics. Again, sorry for that. So, yeah. So they work in different settings like hospitals, clinics, private practices, and community health centers. There are many others also. So dentists obviously will be working in community health centers or private practices or within the GP practice. So if there's a healthcare practitioner, you would expect them to deliver health support. So it starts from initial care up to the process of rehabilitation. So when you want to build a close relationship with a medical practitioner, they're able to support patients and their families. And this they do for the purpose of ensuring holistic care, so that holistic care needs are met. So practitioners who work in various settings, so these various settings were discussed earlier. So they're hospitals, clinics, nursing homes, community health centers, social service agencies. They have different roles within their setups. So they may diagnose and treat illnesses. So there's some practitioners, for instance, there's a radiologist. A radiologist is there to capture an X-ray or to just take an X-ray. That's it. They're not involved in diagnosing the illnesses. So there's another consultant that they send. For instance, a person working in the respiratory department, they'll be working to diagnose illnesses. Then they don't take the X-ray, however, they diagnose illnesses. So they have their different job descriptions. So the people who are practitioners, they diagnose injuries or they treat injuries and conditions. They provide appropriate treatment to patients. They also monitor patients' progress and adjust treatment plans whenever it is necessary. Then there are people involved in preventive care. So practitioners provide preventive care measures like vaccinations, health screening. So we have breast screening, breast cancer screening. We have cervical cancer screening. We have oral cancer screening, for instance. So different people are involved in different preventive measures. And health education is also one way of preventive care. And these are all there to prevent illnesses and promote healthy lifestyles. Then you have practitioners who work in health and social care setup, working as care coordinators. So health and social care practitioners work together, and their basic aim is to coordinate for patients with complex health needs. So this includes coordinating referrals. So there might be a lot of referrals for a patient with diabetes, for instance. He might be going to the hypertension clinic. He might be going to the dementia clinic. He might be going to someone for mental health issues. And then they coordinate with other healthcare professionals. As I mentioned that there's complex care. There are several reasons why care is being provided to them. And then the follow-up becomes complex also. And advocacy is also very important. So practitioners advocate for their patients' rights and needs, including access to healthcare services, social services, and community resources. They also provide support. So if we see practitioners, they provide emotional support to their patients. Just a minute, sorry. So their families, especially during their times of bereavement or times of chronic illnesses, injuries, or disabilities. They would also be providing support for counseling and guidance when they're coping, when their families, their loved ones are coping with chronic conditions or certain major life changes. Then there are practitioners who are involved in record keeping. So if there's a consultant, they might have a person who's separate there for just the records, just keeping the records and updating them regularly. This is for patient information, treatment plans, progress reports. So this information is used to inform future care and treatment plans. So when you have the data there, we talked a lot about data yesterday. So if you have the data there, you know what the treatment plans are already, what the patient has been through previously, and what are the progress reports. And then you can decide what is to be done in the future for this patient. So these healthcare and health and social care practitioners, they play a critical role in promoting the health and well-being of individuals and communities, and their work is essential in maintaining a healthy society for everyone. So there's a short video that I would want you to see. Just a minute. Okay. I hope you can see my screen. And there's the video.
If you're a web designer, Here are 4 Wix Studio features you gotta know.
So here's the video. Internet is not so great today.
The role of a general practice nurse is one of the most exciting jobs that you can have, I feel, in nursing, because you have everything from birth to death. You don't know what's going to be coming through the door. You can come into general practice and be what we call a general practice nurse, and that's what we call treatment room nurse. And that's anything from doing blood pressures, ear syringing, dressings, leg ulcers or other dressings, doing smears, doing immunisations, doing a lot of what I call public health work as well.
No 2 days are ever the same, which is one of the interesting things and challenging things about the job. I specialise in respiratory disease here. Each of the nurses has a different specialist area, so I can be running an asthma clinic and doing routine planned care for people with asthma, or indeed seeing people who are undergoing, who have a flare-up of their condition, so acute management.
There are misconceptions about practice nursing in so much as the role you can feel isolated. You do work on your own, and a lot of nurses feel that they do not get enough protected time for their education and for development. However, in hindsight, this has changed a great deal over the years. We have a lot of support from the Practice Nurse Association, which is run by Royal College of Nursing. Also, there's a Practice Nurse Forum, which you can access online. So there is a lot of support in place.
There's also another area around practice nursing that I think some people maybe not be aware of. And it is actually one of the only places I feel that you can really do some flexible hour and working, because surgeries now are predominantly open from 7 in the morning till maybe 7, 8 at night. So there's the opportunity there for some nurses perhaps to do job shares, to do sort of mornings or afternoons. A lot of practice nurses actually do part-time work, and there's a lot of practice nurses out there like myself that also do full-time work, but the opportunity is there.
As a practice nurse, you undertake a wide variety of roles and can see patients right across the age spectrum, from young children and babies doing immunisations right through to older people, potentially end-of-life care as well, and can gain an in-depth knowledge of long-term conditions such as coronary heart disease, respiratory conditions such as asthma and COPD.
What I enjoy about practice nursing is I get to know the whole family, and it's on a one-to-one basis, and it spans over all those years as well, from 0 to 100, and it's very rewarding to watch people grow. As well as sickness, we do deal with health prevention and cure, so it's nice that you do the promotion of health. So that is rewarding, more than just dealing with someone that's maybe unwell and there's not much positive coming out, but there's a lot of positivity with our role as well. Practice nursing is a very rewarding, very stimulating career, because I find that the family do come in and they always ask for you. The continuity of care is very important to a lot of people, and being able to see that same person all the time makes a great difference in their lives, more than seeing strangers, and you build up that relationship.
I would say if anybody was interested in a career in practice nursing, I would definitely suggest getting in contact with a local practice and going to spend some time there to find out a little bit about what the job involves. It's very, very different from any other role in nursing I've found, but equally it's a very interesting and challenging role.
Okay, that's about it. I'll stop sharing and then I'll share my own screen for the presentation. I hope that was clear to everyone. Okay, so I'll start sharing the screen. Okay, we'll talk about the different NHS careers and different ways that people work. I'll share this in a while with you. My objective is actually to complete the lecture, and then we'll talk about this extra also. So then when we want to explain the roles and responsibilities of like 2 named health or social care professions, if we want to talk about them. So there's some this is a part of your assignment also. So for instance, if we have registered nurses, for example, so they're essential. Now in your assignment, obviously, we've talked about that earlier. So you had a task where you would want to talk about or write about some practitioners, their roles and responsibilities. I think it was roles and responsibilities of at least 2 health or social care professions. So it's up to you, whichever you choose. We'll come to the assignment discussion when all our learning objectives are complete. Not now, but this, as I recall, this is a part of your assignment also. So a registered nurse, they're essentially essential professionals, and they're major. They're one of the workforce that makes a big difference in the health and social care sector. They play crucial roles in promoting, maintaining, restoring health, as well as preventing illness. And they're also in contact with the patients, and they build a reputation and build a relationship with the patients and their families, as was evident in this video that I shared with you. So their main responsibilities are assessment. So they're responsible for assessing patients' health conditions. This is by taking their medical history, monitoring vital signs, and evaluating symptoms. They plan and implement, sorry. Okay. Yeah, they plan and implement care. So implementing care, planning care, it's a role of several others also, but they're the people who are involved also, along with other practitioners. They assess, so their responsibility is to assess for patients' health conditions. This is by taking the, they're based on their assessment. So once they've taken the assessment, the nurse creates care plans, and they're tailored to the patient's needs. So every patient gets what they need. So it's a care, it's a patient-based or a person-centered care. This would include administering their medications, monitoring treatment progresses, and providing emotional support. Now, it's much easier to do it one thing fits for all. It's much easier, but in the real world, if you see, it doesn't actually happen, and care has to be personalized, just as education and other necessities must be personalized. It is more hard, and it is more time consuming, but the end outcome is way much beyond what we expect from when we expect just having a uniform care for everyone. So if it's tailored and if it's patient-based, it makes the best impact. Patient education, so public health nurses especially, and other nurses also, they teach patients and their families about various aspects of their health conditions. So they make them aware of their own health conditions, giving them their information, and then giving their health in their own hands also to some extent, for making informed decisions. Medications and lifestyle adjustments that are required to manage their illnesses. Just a minute, I'll annotate this, and this will be, sorry. Okay, so they are also involved in advocacy. So they act as patient advocates, ensuring that they receive the patients receive necessary care and resources. And they may also collaborate with other healthcare professionals to ensure that the patient's best interests are considered in decision making. And they're also involved in documentation, maintaining records which are up to date, ensuring that all the relevant information is available to other healthcare professionals when it's required. Then we have the next care that is provided by occupational therapists, OTs. So they're specialized healthcare professionals who focus on, helping individuals with disabilities, injuries, or illnesses So they're mostly working with people who are disabled, and it's to regain or maintain their ability in order to perform their daily activities that a normal person would do. And they would also participate in meaningful occupations. The primary roles and responsibilities of OTs include evaluation. So they assess clients' physical, cognitive, and emotional abilities, as well as environmental factors that may impact their ability to engage in everyday activities. They are involved in intervention planning. So interventions are treatment plans. So based on evaluation, OTs develop customized intervention plans. These are to aim to improve the client's skills and abilities, modify that in their environment. So they're making interventions are different experiments also that you do, but safe experiments, or to adapt activities to make them more accessible. This is all keeping in mind the patient's safety, obviously. Therapy implementation. So OTs work with clients to execute the intervention plans, which would involve physical exercises, cognitive activities, or the use of adaptive equipment. Client education, just as nurses, they're involved in educating clients, their families about the nature of their conditions and what is needed to cope with them effectively. They're also there to provide information. So that was about occupational therapists, and they're also involved in collaboration. So they collaborate with other healthcare professionals like doctors, nurses, and physical therapists in order to provide comprehensive care to their clients. As I said, that care has now become very much personalized and very much patient-centered. In that way, it becomes more, it becomes harder, and it becomes a responsibility of people, and we need more people actually to be working with the clients. And if it is a patient-centered practice, then you need more people there in the team. So there's a lot of collaboration also that goes on, and documentation, just as nurses, they have up-to-date client records, which they have to be which have to be kept there for the assessments, intervention plans, progress notes, and other relevant information. Any questions, please let me know. I'm happy to take questions as I go along. Social workers, as the name suggests, they work in social care setups. They're responsible for providing social, emotional, and practical support to individuals, families, and communities. They work with individuals who experience difficult life situations like illnesses, poverty. So they're working with individuals and their families also, even with unemployment and abuse. So social workers assess the client's needs, and they're, again, patient-centered or client-centered, and develop plans to help them access resources like housing, healthcare, and financial assistance. They also provide counseling and advocacy services to help clients cope with their situations and navigate complex systems like healthcare and legal systems are complex for many people. So they help them in those processes. Social workers may work in a variety of settings. So these include hospitals, schools, community centers, government agencies, to name a few. So some of the responsibilities of these people that we've just talked about of a social worker. So it's to assess clients' needs. So it's because it's patient-centered or client-centered, they assess their needs, and then based on those needs, they provide counseling and support for them and their families. They advocate for clients, their rights, and help them navigate the healthcare and social service systems. They're involved in collaborating with healthcare professionals, such as nurses, physicians, healthcare professionals, in order to have the care that is comprehensive. They develop and implement treatment plans with clients to implement them, and they provide education and resources to the clients and their families. Then we have GPs, general practitioners. So you have doctors who are there to diagnose and treat medical conditions in patients. You have different kinds of GPs who are specialized in different specialities. So there's medicine, there's cardiology, neurology, peds, for instance. Some of their responsibilities include conducting physical exams and medical histories, diagnosing and treating medical conditions. So they're basically doing that, prescribing medications to treat medical conditions and manage symptoms, collaborate with other healthcare professionals. So they collaborate with nurses, pharmacists, and therapists, again, to provide comprehensive patient care. And they're also responsible for educating patients. Then you have pharmacists. So they're healthcare professionals who specialize in medication management. Some of their responsibilities include, within the pharmacies, hospitals, and clinic, dispensing medication. So they dispense medication and provide information about proper dosage and usage instructions, including what could be the side effects, conducting medication reviews. So they review patients' medication regimens and identify potential interactions or problems such as side effects, as I said. They educate patients about their medication, potential side effects, and ways to manage the health conditions, collaborate with healthcare professionals, as others do, and manage medication inventory. So there's, again, record keeping and safe and secure dispensing of the medication. So then you have physical therapists. So they're healthcare professionals who specialize in rehabilitation and physical function. They work with patients such as MSK conditions, musculoskeletal or neurological conditions that affect their ability. So they're more related to the physical health of the patient. So they assess patients' physical abilities, such as their strength, their range of motion and balance, to develop individualized treatment plans. They develop and implement treatment plans just as the other professionals do, such as exercising, manual therapy, other interventions to improve patients' physical condition. They educate patients. So physical therapists educate patients about their conditions, their treatment options, and ways to manage their symptoms. They collaborate with healthcare professionals. They monitor patient progress and promote patient independence. Again, the same website has come. I'll talk about this. So we'll explore the different NHS careers and how they all make a difference. And you would want to list and understand 2 practitioners' roles of your choice when you're doing your homework. So this is an activity that I would want you to do. So you've got one assignment that I sent you yesterday. It's for calculating the central tendencies. We'll talk about all of these on next Saturday. So because of time constraints, I really want us to go through this second learning objective. So this is your assignment. So visit this website. I'll share the link with you, and list and understand 2 practitioners' roles of your choice. This is also a part of your main assignment, so it will help you later on. Then we would want to identify key features of effective partnership working. This is the last bit that we have here. So effective partnership working, it has several key features. So you have shared goals and values. So all the partners, so their nurses, their physical therapists, their OTs, their GPs, they all work for one set of goals. And the main reason for them is they have the same values and the principles that guide their work. This would help them to ensure that all partners are working towards the same objectives and their efforts are aligned. Then you have clear roles and responsibilities. We've talked about what the roles and responsibilities are. They are clear for them as well, and they educate the others around them in that team also to have a clear understanding of what they can do and what they can't do. Effective communication is essential, is the backbone for every profession. So that helps to build trust and mutual respect among partners. Trust and respect is very important. So every partner should have high level of trust and respect for one another. This means being reliable, transparent, and honest in all dealings at all times. You make decisions that are joint. Your decisions should not be conflicting with each other. If there is any conflict of interest, that should be declared effectively. Then there is flexibility. So effective partnership working requires flexibility and adaptability. For instance, if there's one person who can't do a certain task, the other will chip in. And when that person needs assistance, that first person will then chip in as required. Partners must be willing to collaborate and compromise when necessary to achieve the shared goals. And then commitment and investment is very important. So effective partnership working requires long-term commitment from all partners and investment of time, resources, and efforts. They all must be willing to work together and have the same shared goal. Team working and multidisciplinary working. So partners working within teams and multiple disciplines. They have related concepts that involve collaborating among different individuals or groups to achieve one common goal. That one common goal is the driving factor for all. So it's a broader partnership working is a broader concept. It would refer to collaboration between different organizations, agencies, or sectors, such as healthcare and so it's they're also working for individuals and families and communities. So effective partnership working would involve building trust, communication, mutual respect among partners, and working together to achieve, again, their shared goal. Teamwork is another term. So it involves collaboration among individuals within the same organization. So partnership would maybe have not be the same organization. It involves different organizations. So teams may be composed of individuals with different skills and expertise, and effective teamwork requires clear roles and responsibilities, effective communication, shared accountability for achieving the team's goals. So multiple disciplines are working together. So they're physicians, nurses, social workers that provide comprehensive and coordinated care to patients or clients. So they're all, again, working towards one active goal. And there are many more people who work in this multidisciplinary team. All of these concepts, in all of them, effective collaboration requires clear communication. We've talked about this earlier, shared goals, and a willingness to work together. So there's one common objective for all. Effective collaboration can lead to improved outcomes for individuals, families, and communities, as well as more efficient and effective role for all. So now we'll talk about how effective partnership working, what does it require? What are the important components? So it's communication. We talked about this earlier. It's identifying barriers and then reducing them. So there may be some lack of resources somewhere. There may be communication breakouts. So when your partners, you identify each other's barriers and address them. You understand each other's boundaries and you help them, you support each other. And then you contract, you keep more people, you include more goals, responsibilities, and expectations. This would help to ensure that everyone is on the same page, everyone is clear of their misunderstandings, and everyone knows their roles and responsibilities. This is a table outlining the relationship between different, it's several partners that are working together, and the relationship between health and social care. So I want you to go through this also, have a read of this, and we discuss this in our next meeting. So overall, these partners, when they're working together, it requires a high level of communication, collaboration, and coordination among partners. When you work together effectively, it brings better outcomes for the patients and your clients. So these are some of the references. This is the plenary. Just have a read of this, and I will meet you Saturday, next Saturday, 10 a.m. Any questions?
Excuse me.
Yeah.
The assignment,
Yes.
are we going
Yes.
to do it in a sheet of paper, scan it and send it to the necessary email?
The assignment, sorry.
The assignment,
Yeah.
are we going to do it in a paper,
Yeah,
scan it
you
and
can
send
do
it
it.
to
Yeah, you can do
you?
it on a Word document. So that will help you later on also in your final assignment for the unit. So it's okay. You can do it on a Word document. That will save you time when you're doing your final assignment.
On a Word document?
Word document, yes.
Okay.
Okay. Any more questions?
Together with the one you gave us yesterday, the
Yes,
two.
we'll discuss that on Saturday next weekend.
Okay.
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 Anything else? Okay. If there's no more questions, I'm happy to leave you.